You are most welcome, members of academia, and don't forget to follow us also on our page, Facebook page as academia, and WhatsApp platforms. We have each particular course has its own WhatsApp where we discuss these NMCZ past papers. Do not forget as well to follow us on YouTube, where we post videos that really explains tips given on how to tackle questions from most of the examination papers. We want to welcome you to academia platform, and we are going to consider Irh-May July 2020 multiple choice. Presenting is Mr. Malambo. That is the line. You can WhatsApp us or call us, and we will definitely attend to you. We are going to consider multiple choice. Okay, multiple choice. Corrections and any explanations are most welcome. Let's begin. The first question says, the hormone responsible for a positive pregnancy test is. The hormone responsible for a positive pregnancy test is. So from the options given, the answer is C. Okay, human chorionic gonadotropin. Now, this particular hormone positively tests for pregnancy. It indicates that the human being, lady, is pregnant, to say. Question 2 says the hormone responsible for the maturation of the graphene follicle is. Question 2, the answer is C. Okay, follicle stimulating hormone. The hormone responsible for the maturation of the graphene follicle is follicle stimulating hormone. Question 3 says the most common normal position of the fetus in utero is. Okay, the most common normal position of the fetus in utero is. Question 3, the answer is B, vertical position. Vertical position. Question 4 says in the later part of the third trimester, the mother may experience shortness of breath. This complaint may be explained as. Question 4, the answer is B, the fundus of the uterus is high, pushing the diaphragm upwards. Okay, that is the answer. Now we are not explaining, okay, because we have really limited time. Okay, we have limited time, but we are going to do this paper as well in our WhatsApp platform where we explain in detail. But sorry for this time, we really have little time, so we are not giving details of what we are actually reading through, rather answering the paper. For more explanation, if you have a question, you can just reach us and we will be able to attend to you. Right, let's continue. Question 5, it says which of the following findings in a woman would be consistent with a pregnancy of 2 months duration? Which of the following findings in a woman would be consistent with a pregnancy of 2 months duration? The answer for question 5 is B. Okay, fullness of the breast and urinary frequency. Okay, question 6, which of the following is a most positive sign of pregnancy? Which of the following is the most positive sign of pregnancy? So question 6, the answer is C, positive pregnancy test. Positive pregnancy test. Okay, Question 7 says, what event occurring in the second trimester helps the expectant mother to accept the pregnancy? The answer to 7 is D. Okay, quickening. What event occurring in the second trimester helps the expectant mother to accept the pregnancy? Quickening, right? That is question 7. We go to 8. Shoes with low, broad heels plus a good posture will prevent which prenatal discomfort? Question 8 is C. Leg cramps. Okay, shoes with low, broad heels plus a good posture will prevent which prenatal discomfort? Leg cramps, which is C. Question 9 says, when a pregnant woman experiences leg cramps, the correct nursing intervention to relieve the muscle cramps is number 9. The answer is D. Ask the woman to raise her legs. Okay, ask the woman to raise her legs. Question 10. The following are ways of determining the expectant date of delivery. EDD. When the last monthly period LMP is unknown, except so we are asked. The following are ways of determining the expected date of delivery. EDD. When the last monthly period LMP is unknown, except number 10, the answer is B. Okay, quickening. Now this one, that is an exception. Whatever that remains there helps us to determine the delivery of the child, or rather the fetus to say. Okay, except for quickening. Okay. Question 11 says, if the LMP is January 30, 2020, the expected date of delivery EDD will be 11. The answer is A, October 7, 2020. Okay, there is some calculations that are supposed to be done there. So this one will actually do it. Don't forget to reach on us. Okay. 12. Kegels exercise is done in pregnancy in order to, so 12, the answer is D, prevent leg varicosities and edema. Okay. 13. Pelvic rocking is an appropriate exercise in pregnancy to relieve which discomfort? 13, the answer is D. Okay, backache. Then 14, the question says question 14, the answer says the main reason for unexpected increased need for iron in pregnancy is 14, the answer is C. The fetus has an increased need for RBC, which is red blood cells, which the mother must supply. Okay, that is the answer. 22. The following are skin changes in the pregnancy, except 22, the answer is B. Okay, styria gravidarum. Okay. Then 23. Which of the following statement is true about conception? 23, the answer is B. Generally, fertilization is possible 4 days after ovulation. Okay, after ovulation. 24. You are performing abdominal exam on a 9-month pregnant woman while lying supine, which she felt breathless, had pallor, tachycardia, and cold, clammy skin. The correct assessment of the woman's condition is that she is, the answer is D, going into shock. Okay. Let's run over. Then 25. Smoking is contraindicated in pregnancy because 25, the answer is D. Okay, nicotine will cause vasoconstriction of the fetal blood, vessels. 26. Which of the following is the most likely effect on the fetus if the woman is severely anemic during pregnancy? So 26, the answer is C. Okay, small for gestational age baby. 27. Which of the following signs and symptoms will most likely make the nurse suspect the patient is having hydatidform more? Okay. So the answer for 27. Okay, the answer for 27 it's going to be C as well. Okay, absence of fetal heartbeat. 28. Upon assessment, the nurse found the following: the fundus at 2-finger breadth above the umbilicus, last menstrual period 5 months ago, fetal heartbeat not appreciated. Which of the following is most possible diagnosis of this condition? Okay, so 28, the answer is B, missed abortion. Okay, missed abortion. 29. When a pregnant woman goes into convulsive seizure, the most immediate action of the nurse to ensure safety of the patient is 29. The answer is B. Okay, put a mouth cage so that the patient will not bite her tongue and the tongue will not fall back. Okay. 30. A gravidocardiac mother is advised to observe bed rest primarily to 30. The answer is B. Okay, minimize oxygen consumption, which can aggravate the condition of the compromised heart of the mother. Right. Then finally, 31. A pregnant mother is admitted to the hospital with the chief complaint of profuse vaginal bleeding, gestation age of 36 weeks, not in labor. The nurse must always consider which of the following precaution. For 31, the answer is D. Internal exam must be done following the routine procedure. So this is what we had for you. Now, because of time, we have only managed to consider these particular questions. You can follow up for more particular questions. God bless you. Thank you so much.